So let me introduce you to Lauren, our model for today. Lauren is 29 weeks, so she's just at the start of the third trimester. She works as a nurse and she's just getting towards the start of her maternity leave. We're now going to do some warm-up work on the back. Now you can do your normal warm-up work here. I'm just applying a little oil. I'm in a bit of a different standing position here, just so that I'm out the way of the camera so that you can see what I'm doing. But you can see I'm starting to move the skin, and you can just do your normal warm-up. If you normally work in a particular way, then it's okay to carry on working that way. The main thing we're doing here is trying to kind of wake the muscles up and let them know that we're here. We're starting to move the first few layers of fascia, and we're starting to increase the superficial blood supply, or the blood flow to the back. Again, we're working a little bit differently to how we normally would, because obviously Lauren is on her side. We tend in pregnancy massage to work more this way up the back. If somebody was face down, we would tend to do the strokes down and then back up, but it's not as easy to do that. So just adapt your treatment as you go, and again you can just be adapting your normal treatments here. So now we've done that warm-up, we're going to do that kind of diagnostic work along the spine to see where it's tight. As I'm feeling up Lauren's back, it's fairly relaxed until we get to about here, that kind of bra strap line area. And you can just feel that the tension increases there. It then relaxes again higher up, and it comes back in a little bit at the shoulders. But I would say that if I was going to focus anywhere for Lauren's work, it's really around here. So I'm going to do a little more in-depth work here. But it's still those kind of warm up, the bigger strokes. And you can see we start to get a little bit of flushing in the skin, which is good. You can use the back of your hand. All we're doing is we're avoiding any direct work on the spine as we normally would. But we're using these sweeping movements as part of our diagnostic work to see where is that tension. And it's right here, which is kind of what we would expect for a pregnant lady, because you've got that, the whole thing we were talking about earlier, with as the breasts grow, it puts more pressure, and it's this area of the back that really kind of takes the brunt of that. Then we're going to move to work across the top of the shoulders and this outer shoulder area. This can be very tender, and that might be a tenderness that's come well before pregnancy. Often people who are computer-based, if they're working with their arms forward a lot, or if they're lifting, this will be a tender area. So I'm starting to feel across the top of the shoulders. And you can see, again, we're adapting how we would normally work. This would normally be done with the client face down, or we might get some really good pressure into here. But we're being gentler because it's pregnancy massage anyway. But we're also adapting how we go. Now we try and do that on both shoulders. Obviously it's harder with the left shoulder. You can just get as far as you can get, so you have to work with the individual client and which part of their shoulder that you can reach. If you feel you can't really get into that left shoulder, you can move to a seated position to do that, and we'll show that shortly. So we do this work on the shoulder. If you imagine normally you'd be sweeping down here and out and round, and so we're just separating those movements. So instead of doing the sweeping up the back and then the round, we're coming up the back and we're coming up from about here, and then we're doing that sweeping round. Now work very, very gently when you get to this part. This can be a very tender area to work. Now normally we might do this again with the client face down, and I will often do this with the arms dangling off the table. But because we're working in side position, we're just working a little bit differently. So you can see I'm still putting some pressure on there, but it shouldn't be really painful pressure. It should feel nice, and it should feel as though it's doing something. But I'm not just stroking across the skin. It's not just straight effleurage where I'm very surface. I am working deeper. But you can see it's all big movements, it's flowing movements. I'm not pointing in at all. The movement is quite fluid. Now we can't get to this very easily here, but we can do a little bit of work on the left shoulder. So we do what we can within the limitations of the client's position. Then I'm going to ask Lauren just to draw her arm back a bit, and you can see in doing that the scapula comes out. You can just rest your arm down. Perfect. So we're working behind there. This really allows us to get in and resolve any tension that's behind here. Again, it's the same movements that you would normally do, but this time adapted for pregnancy. Thank you. And you might see here, we've got it with Lauren here, as the position she's in, because she's laid on the left side, actually the scapula does rise, so I can naturally get in here. So we'll just show that again. We can bring the arm back so that the scapula comes out, and then we're working behind the scapula. It can be a real place for holding tension, so you can use the smooth movements. You can here, you can work inwards as well, in towards the scapula, away from the spine. You might feel a little bit of clunking and clicking in there. That's quite normal. That's things nicely releasing as we work. Thank you, Lauren. We can see again on the left arm, the scapula naturally comes up because of the position that Lauren's laid in, so I can nicely get in behind that. So we'll just recap things we've done so far. We've done that hand and the arm work. We've done the warm-up on the back, the general warm-up work. We've then done that diagnostic work, coming up the spine to find out where any tension is. We've done that work across the top of the shoulders and around the outside of the shoulders. And then we've done that work on the scapula where we're bringing the arm back. You can see the scapula comes out and we can get underneath there for the work. It's easier on this side in some ways because it naturally lends itself. Because Lauren is laid on her left side, her scapula comes out and we can naturally work behind that. Having done that, we're then coming just to the top of the shoulders and up the back of the neck. Now again, we would normally do this with a client face down, but we just adapt it. You can get to most of this work. I'm being very careful just to stay at the back of the neck. I'm not slipping forward, which feels very uncomfortable for the client. You can do that roll across the top and then up, but you can also come down and out and across. It's quite nice just to pick this up again at the base of the skull. Do a little more detailed work here. I'm just making nice little circles. Medium pressure, which is all we're going to go to in pregnancy massage, just to try and release the neck. Remember the issue we discussed earlier with the growing breasts, that will affect all of this area and it can affect right up into the neck. So just making sure that we give the neck a little bit of attention all helps with that. You can see my movements are quite slow. I'm not doing anything vigorous. I'm not doing anything too deep. And again, you can adapt your own techniques, your own style here. We're not doing anything here that is going to cause any problem. We're now working from behind Our Lady. We're working the spine, we're doing that warm up and we're coming out across the shoulders, and then we're going to feel for those areas of tension. Now, of course, we're now working with the clients clothed. So it is a bit of a different work. We can't get that same movement as we do with the oil. So I do more of little kind of circles to warm things up. Again, you will have your own techniques and it's absolutely fine to adapt them. Just be careful that you're not working too deep, but you are working deep enough to actually have an effect. You can come both sides of the spine at once. I'm not working terribly deep here. I'm just getting things warmed up. So I'm doing this by making little circles, and you'll see when I move above the claws, what I'm actually doing is I'm moving the skin. So I'm starting to do that fascial work. We're moving more of the surface structures, and I can move across the shoulders there. Now we can do more warm up in the shoulders. You can mix and match. You could use a little bit of oil here now. We've still got some oil from the previous treatment section, so I'm just making use of that. We're coming back down. We're working from just above the sacrum now. We'll talk more about that shortly. But I'm doing that warm-up work. Getting everything moving. So you can see it's not as smooth as it is when you're working with oil. You can't do that kind of same movement across. If I move just across like that, all I tend to move is the actual clothes and maybe the very, very top layers of skin, whereas I'm looking to move a little bit deeper. So you can see there on the skin, I've started with small circles, and now I'm doing bigger circles. So I'm getting more of the structures to move. You can come up both sides at once because I'm not putting any pressure on the spine. I don't need to work both sides at the same time as we would if we were doing deeper work. So I can come up and down. And as I'm moving into this next level, I'm then starting to do that diagnostic work to say, so where are the areas of tension? Where are the areas that I need to put more attention to in order to help Lauren more? And again, as we saw on that face down work, it's here. It's just around that bra strap line. But it's not as much as it was when she was face down because we've already removed some of that tension. Sorry, in that side position, not face down. We've already removed some of that tension from that side position work. Then we're going to move to work across the top of the shoulders and this very tender area behind the shoulders here. I've added a little extra oil here just because the first lot of oil has been absorbed. Now you can adapt again what you're doing. You can get some quite nice rolling movements here. Again, be careful of your depth. We're keeping to medium depth. But get feedback from your client as well as to what is the correct depth from here. This particular part is actually easier to do in the seated position than it is to do laid down. You can see I can get in much more. It's much more gliding movements. I can use the heel of my hands. Let's keep the hair out of the way. And I can come backwards and forwards, backwards and forwards. I'm never putting any pressure in the spine. You'll see as I come to the spine, I'm avoiding putting any pressure on it. My hands are meeting just short of that. You can move downwards as I have just done then. You can move upwards. So I'll show you that again. Moving down from neck across to the shoulders. I am medium pressure here. I'm not just kind of tickling. I am adding some pressure because I'm aware that this is an area that for Lauren will be a bit sore. And while I've got my hands across the shoulders here and I'm doing that work with my thumbs, I'm not squeezing. I'm not putting pressure on my fingers as well. This is just for balance. So the only pressure is actually coming from my thumbs. And again, you can use the heel of your hands, the side of your hands. We come out to this area behind the shoulders and we can do the same thing. So I'm not squeezing the shoulders. These fingers aren't doing anything. They're just there for balance. Be careful of your depth here because even what you think is a medium depth might be quite tender for your lady. Remember, this is one of those areas affected by breast development, breast growth. So you can see I can do both sides at once as well, which feels like a nice balanced treatment when you're receiving it. And I can keep coming back. I can come back to this area. We can repeat the strokes here, those circles. We can repeat that stroking outwards. And then we can come back to here. So we're not necessarily staying in one place for too long. You can do that 2-3 times. It doesn't matter how many See what time you've got, see how your lady is feeling, and see where she's actually carrying her tension. See, there's some tension up here, so this is what we're working on, just stripping away with these moves. I'm just going to show you that again so you get a kind of fuller shot of it from the camera. This area here is the area that can be very tender, particularly if you're lifting, if you've got a manual handling job, or if you're doing a lot of computer work, basically where your shoulders are rolled forward all the time, but also where breast growth has pulled your shoulders forward. And so we're getting in here. We're being fairly gentle, and you can see it's smooth moments. There's nothing proddy here, smooth movements. If I start prodding into here, it gets very uncomfortable for the lady. So we're keeping it nice and smooth. We can come backwards and forwards, we can make circles. The main thing is we're getting that tissue to move. And you can see there the depth that we're moving at. We're not just on the surface structures now. We are moving deeper. But we're still only at a moderate depth. Then we're going to move to this area behind the scapula. Rather than me move Lauren's arm back, I'm going to ask Lauren to bring her arm back just to a point where it's comfortable. It doesn't matter if your lady only brings her arm to the side or it's right up here. It's just wherever is comfortable for that individual. I'm going to support the shoulder because I'm going to press forward, so I don't want to be pushing her off the table. So in supporting the shoulder, I'm just giving that stability. And you can see there my thumb is just sliding underneath the edge of the scapula. Now it will depend on how much tension the lady has in this area, how deep you'll be able to work, how far under the scapula you'll get. For some people you won't get under at all, you'll just get along the edge. And it's a kind of press and release. It's not quite as smooth a movement as it is when we're working with oils direct onto the skin, but it's still a very, very effective movement. And then we'll repeat that on the other side. And so we'll do the same with the right side. So again, I'm going to ask Lauren just to bring her arm back. And I'll work right-handed just so that you can see where I am. I'm round behind the scapula. I'll switch hands. So you can see here my thumb starts to disappear underneath the scapula, but all I'm doing is a kind of press and release action. Again, I'm just pressing Lauren's shoulder, so I'm not just pressing her forward. And it's just a kind of moderate pressure, press and release. And this is to try and kind of reset these muscles that have been strained. So doing those small circular movements at the base of the skull. And you can see here I'm bracing my hands. I'm just using my fingers to stop Lauren's head being pushed forward as I do this. So this is one of those movements that it's actually easier to do from the side position because you haven't got that forwards pressure on the head with this. So we'll pick this up again when we come to the head work in a little while. So moving down through the spine, down through the neck, across the top of the shoulders and up to those little circles.